Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 3, Patient Safety Management, Infection Control and Medication Safety, Chapter 32 deals with medication safety. It discusses about the selection, procurement, storage of medicine, ordering and transcribing errors. In selection and procurement, the selection of the medicine should be based on evidence of safety. It should have a discussion on efficacy and suitability. The three important components need to be understood when you are selecting a medicine. A purchased medicine should undergo a quality control. The quality control is needed to ensure patient receives safe and effective drug. If you are not going through a quality control, it hampers the issue of patient safety. We compromise with the safety and it also can deal with the effectiveness of the drug. Good selection eliminates drug with doubtful efficacy or irrational combination. So many times when you have to have a debate actually for how you need to work on the irrational use, it is more like your good selection will give you more clarity on the doubts. The spurious or substandard drug circulation is a major concern at national and facility level, which has been seen as more a cause fueling actually to the issue of selection. What are the studies which are stated on this issue being reported as? The study in 2012 in USA which shows that there was an outbreak of fungal meningitis which was due to contaminated injectable steroid compounded under the unhygienic conditions which was at New England Compounding Center and that resulted to 46 deaths and, and 704 affected patients. So you can understand what this report gives the graveness of this issue. This highlighted the need of a strict procurement standard and a high quality drug sourcing, which is very important when you come across such an issue with as being seen as the pre-qualification criteria which needs to be led when you are taking this strict procurement standard which is laid by the national regulatory authorities as well as even by WHO. So all these reportings will show what are the selection and procurement of medicines in terms of importance of taking this issue as a priority. So you can see in this figure that how the detailed storage of medicines like maintaining the potency and effectiveness has been seen as. When you talk about the general storage principles, the medicine need to be stored in a cool and dry place. It should be protected from sunlight, moisture, and it should be away from children's with a high shelf and locked cabinet, which needs to ensure with the safety aspect. The temperature should range from 8 to 25 degrees Celsius, we can say even at a room temperature. The consequences will be like chemical degradation and reduced efficiency would be more majorly tackled. What are the methods actually to reduce the errors? The methods at facility level and at patient or at a home level, which can be distinguished and which can be seen as when you have to tackle the errors actually at a facility level, you need to follow the manufacturer species like packaging inserts, controlled distribution in terms of refrigerated trucks and containers, routine temperature monitoring and alarms which has been seen, and staff training on cold chain protocol, which is very important that you need to ensure that when you have to reduce the error, you need to understand at a facility level to follow all these protocols. At a patient level or at a home level, when the patient has to take care of to reduce or even at a home based care, you need to educate the patient for demoing or you can even induct the patient for proper storage and even understand if at all the patient is transferred or the patient has its own choices of travel plan and tips to take that how the medication errors to be understood. Then securing the storage in terms of lockable boxes or out of sight where it needs to ensure the safety of this. Checking expiration dates regularly to ensure that the patient should not take expiry drugs. Use of insulated travel bags, collars for insuling and even very sensitive drugs which needs to be thoroughly checked in terms of its safety. Then comes the cold chain management requirement, which is to be ensured that it should be 0 to 8 degrees Celsius. So the temperature range should be 2 to 8 degree, which should be in a refrigerator and not to be freezed, which is to be very much understood. The cold chain definition where uninterrupted refrigerated transport and storage rather than not just only putting in a refrigerator which doesn't comes with a uninterrupted supply, where you need to even think on high risk drugs, particularly vaccines, enzymes, hormones, which also includes insulin, biologics, and even some eye drops, which comes into the category of high risk drugs. What are the risks actually which are associated with the cold chain requirement? It is like irreversible protein denaturation, immediate potency loss, and when you have to take up for the monitoring part, you need to think about the use of calibrated thermometers, minimum and maximum logs, which has to be catered in terms of maintaining it. Then we can see a case study which is a storage error impact, where a patient profile where 60 years diabetic female which complains with the dosage and poor response. What are the issues? Persistently high blood pressure despite the insulin. So on investigation, it has been founded that the pharmacist interview revealed that improper storage during the vaccination travel. So what is the root cause if you have taken this issue in terms of a quality matrix, which shows that the insulin exposed to heat in car, which created a potency issue, that the potency is lost. And what is the outcome of this? The sugar stabilize after new properly stored insulin and re-education. So the outcome needs to be on the basis of the solutions which comes or by the results which comes from the root causes, where you need to think and you need to even understand what are the lessons that need to be devoted to, which is more on the critical role of a patient counseling on storage. So if you see and emphasize on this case study, it is more towards developing a practice of monitoring, a practice of investigation, a practice of understanding what is the cause and working on that in terms of the outcomes, and the resultant solution needs to create a lesson, or it can be developing some standard practices. So this is with storage of medicines. Then comes ordering and transcribing errors. Are there any errors which are completely which can be seen with respect to ordering or transcribing? Yes, it comes to. When it comes, most of the medication errors are occurring in ordering and transcribing along with all other medication errors. So these errors can be seen by majorly being seen by practicing by the doctors. So if you say transcribed onto charts by residents, by junior staff and nurses, intended to the pharmacy by nurses, documented in files by the doctors and nurses. So you can find that what are the issues which can be seen as major contributed by the healthcare professionals. You may see that many times multiple people are also involved. You may see that the higher risk of misinformation or errors is more because of a lot of people are involved, not only in decision making but even in the entire process, which is more filled with the complexity. The medication errors related to ordering and transcribing can be ascribed to a 5 processes. What are those 5 processes? The processes are prescribing, transcribing, intending, and documentation, which can be even added with verbal orders. So when prescribing starts and when you have to go for the transcribe, intending, documentation, and verbal orders, you may see that there are multiple ways actually that you can encounter and can see that medication error can happen over there. With respect to prescription errors, what is the stand that I have reported in 206? But the preventing medication error report of IOM stated that every step of the medication process is prone to errors, especially while prescribing and administration of the medication. When you are prescribing, there can be a lot of chances that you can miss, and while administering, there are a lot of chances that you can miss actually while administering the medications. So these are the two things which you need to understand, that is, one is the P and one is the A. So what is the PA, which can reduce a prescription error, is the prescribing and administering. When you are inducting to your healthcare workers, actually you need to emphasize on making them more responsible of these chances. So these chances need to be reduced. What are those chances which occurs actually? A prescription error. A prescription error may occur by while choosing the medicine. Then comes with the dose of the medicine, the strength of the medicine, the pharmaceutical form, and even the route of the medicine. It can be added with the duration of the treatment which is being given to the patient and the instructions for use. So you may see the entire gamut is more filled with lot of chances that can allow actually to penetrate that the medication error can happen. While prescribing, it involves lot of incorrect prescribing, which may be including with the irrational drug choice, which is sometimes very inevitable or sometimes in a very uncontrolled way that you cannot work really on that without the help of the clinicians. Then is the wrong dose versus strength, which is also very important as an interlink or a teamwork activity where you have to improve when a quality manager or quality team suggest in improving this practice. Wrong route versus the frequency and unclear dilution or administration instructions are very much in a line fulfilling the requirement that needs to be worked on the prescription errors. Adding to it, there is illegible prescription significantly which increases the risk of medication error, where you find many times it has been seen that when there are reporting, it has been encountered that these reasons are to be worked on rather not putting a blame or giving excuses of the prescription error or sometimes unjustifiable explanation which gives sometimes no reasons actually to punish the culprit actually for that part. Now we can discuss a case study of illegible prescription. A 25-year-old male was prescribed tablet fexofenadine, which is Allegra, that is 180 milligram, and HS, that is bedtime, which is to be taken at the last dose of the day. So what happened? So due to illegible handwriting, the patient understood the dose and the patient understood the dose wrongly and he took it 3 times a day instead of only taking it once daily, that too for 3 days. So what happened? You may understand what this drug really cause. It cause over drowsiness, it can cause dizziness and too many side effects actually when it is taken as an overdose, which can be only being seen as a very preventable error. And this could have even harmed more if the patient is working or with some important works actually which may gives more chances of even a mishap or even some major problems to the patient. So even there is an adding actually of a therapeutic duplication. What occurs when same medicines are prescribed either by different brands or in combination, or sometimes when the drugs from the same category are prescribed together inappropriately? So it can create havoc. Yes, it can. So most harmful when patient exceed the maximum dose. It is majorly being seen that patients are completely aloof of the information of what overdosing really causes to. Overdosing is something which is can be many times fatal, can also create or can lead to lot of adverse event. So often the therapeutic duplication comes due to lack of awareness about the brands and even lack of awareness about the drug combinations. Now we can see a case example of this of therapeutic duplication. A 68-year-old diabetic male presented with severe lactic acidosis. Lactic acidosis is a condition which can be seen with lot of issues. On reconciliation, it was noted that he was taking this combination, a combination of glycid M, that is glyazide 80 milligram per plus metformin 500 milligram, and one tablet BD, that is twice a day, and Genumet, that is Shelpling plus metamorphin 1000 milligram one tablet BD. So you can find it that the metamorphin was given in double or has exceeded actually the requirement of the patient. So his total daily dose of metformin dose is equal to 3 grams. Above recommended level, that is 2.25 grams, likely cause lactic acidosis and which has reached to a severity to the patient which the patient started representing actually the severe lactic acidosis, which was to be seen that if at all the prescription or even the therapeutic duplication could have been avoided by reducing actually this loss, and the patient would not have to be faced with this issue. Especially this case is more towards a patient which is more a geriatric age group patient, which is many times being seen as a missed, and when the patient is with more comorbidities, it is very difficult for the patient even represent the symptoms, and which is very difficult even for the physician actually to encounter. Without this, we cannot really see that the patient reduces with the harm of this. And if you are really working or making this in line, actually you need to really think on seeing what are the medicines which are prescribed, what are the particular doses, and whether it is exceeding or not is very important. So now in this figure you can see who is at the most risk of medication error. If you can see with this figure, you can understand the very first important is the polypharmacy and irrational use. Polypharmacy is increasing a lot, which is increased by the medicine count. What is the higher risk of that? It gives a higher risk of adverse drug reactions and even medication errors, which is very alarming actually to be seen, that you need to work as an healthcare workers very importantly on the polypharmacy and reducing the irrational use. Then comes in this as a LASA. What is LASA drug? LASA drugs are like look-alike and sound-alike medicines. Many times you may see that many times it is being seen while prescribing, you may find that there is some of the spellings actually which are very familiar, or sometimes when you spell actually, or you need to see that how it really sounds to us actually, which is very similar. So the LASA drugs are being seen uh, to be look-alike and sound-alike medicines, which creates a lot of confusion actually with respect to the identification, with respect to the spellings, and many times how you spell the drugs. Example, denolin, that is, and Davol. So one is one which is a diabetic, and second is with the antacid, which creates a great confusion between these two medicine. Glinase and zinase, which you can find is a great difference actually in the contents of the medicines versus actually the pronunciation part, and all those are find very similar actually, which creates the event of LASA drugs, and where we find majority of risk is more because of the LASA drugs also in addition. Then comes the use of abbreviations for drugs name. The acronym lead to misinterpretation, and many times it is a great confusion that how you are using the acronyms. Rather saying that you need to work on a culture developing of avoiding the acronym. Full examples like ASA, that is aspirin, or 5-ASA, that is 5-amino salicylic acid, PCM, that is paracetamol, CPM, that is chlorpheniramine, or CBZ, that are carbazamine, or THP, that trihexyphidine, or TFD. So you may find that the trifluorhexene or similar type, there's lot of acronyms or abbreviations which are more actually which can be seen in terms of developing actually more reasons of medication errors. Then comes error due to mix up, character of confusion. You can see the numbers over there, which is one or many times can be seen as a character which is confusing. Okay, 1:1 or 0:0 or 2 to Z or 1 to 7 and so on. Actually many times when a clinician, physician is writing, he needs to be very clear, she needs to be very clear on what they are really writing as. QID, which can be misread as Q1D or 4 into dosing errors. So many times your prescription is very important actually to be seen as a very indicative way of representing how you really are expecting that a patient or the pharmacist or the nurses needs to give this medication. Then comes the high alert, high risk medication. Errors which causes severe harm even if not frequent. Examples are heparin, insulin, concentrated electrolytes. So you can say these are the high alerts and the high risk medication which needs to be carefully handled, and if at all if there are any issues or some by mistake, it can lead to a major problem. Then lastly actually we can say errors prone abbreviation and symbols. The symbols causing misreading, okay, lesser or higher or at rate or CC, UG, U and D by C. So examples of Tegretol 300 milligram may be misread as 1300 milligram, very unclear spacing. So you may see that typing or a writing or sometimes understanding or interpreting can also lead to lot of issues because of error prone abbreviations and symbol. So where you can find use of errors for drug names versus to error prone abbreviations and symbols, which can create a problem, which can be most being seen that if you have to understand this, you need to have a display, you need to have a practice, or sometimes you need to take an audit of number of issues or events that has been reported by medication errors. To work on this, you need to understand what are the most risk of the medication errors. In relation to this, and even to further going, is like what are the methods to reduce the prescription errors. Appropriate prescription writing, where legible, which is preferably should be in caps and it should be complete. We should include the patient's name, the drug's name, dosage, forms, frequency, diluents, strength, duration and purpose. When you're starting from the name of the drug to entirely completing the duration and purpose, it needs to have a full names differential like Lassa medicines, and you need to even work on mentioning actually the preferably generic name rather not the brands to be mentioned in bracket if though you have to give it to. So tall man lettering for Lassa, where you can say dopamine versus dobutamine. So use of standard international SI units for the strength, and you can fulfill actually that your prescribing should be very appropriate. Then if you have to see the second line of this, which will come to be seen as avoiding problematic abbreviations. When you have to see that key, do not abbreviate. Now abbreviate is like in micrograms you can say or nanograms, so it can create a issue. So you need to work only on the caps. Avoid actually the continuation of abbreviation. Do not abbreviate units. So you need to put it in terms of a flyer, or even you have to display it to your facilities for your healthcare workers to reduce maximum of this issue, or you need to encompass this in your training to avoid this problematic abbreviations. What are the issues with spacing and clarity? So always keep that space between the drug and the strength when you're writing or when you are understanding it, it needs to be seen very clearly. Example, Tegretol 300 milligram. Without space, it can be seen as Tegretol 1300 milligram, which can be a risk which we have even discussed in the previous slide also, where you find avoiding unnecessary decimals or do not use naked decimals, or if unavoidable, use leading zero quantities, and in terms of quantities what is higher or lesser, you need to make it very clear, and decimal related errors can be reduced actually if you are emphasizing on making this very clear to the patients or even when you are prescribing it also. Then comes PRN prescription. For as needed SOS order, you need to specify minimum doses interval, specify maximum doses interval, or clearly state the purpose actually. If you have to give some additional information where sleep, pain relief or any additional things, you need to make that your prescription should be error free. It should be complete prescription and should make an appropriate action to reduce all these which are listed over here as to make it a more proper and a clear prescription. Now we will discuss about transcription errors. What are the issues which deals with transcription errors? Intents refer to a computerized handwritten request sent to the pharmacy for dispensing medications. So if you say this medication errors may occur due to illegible handwriting, where you can say Lassa drugs or brand name confusion or incomplete information, you may come up that transcriptions may lead it more further. What are the reasons for the occurrence? Although less frequent, 1 or 2% of this error still pose a risk, because when it occurs, it can also have a depth of major problems. Often of this, if they are caused because of indents, have a high probability of directing reaching to the patient without multiple checks. So what is the reasons of occurrence is one to be very much understood, and if you are able to identify, you can even hamper actually to lead it. So you can understand from the case study which we are trying to discuss for the transcription error, it is that a 50-year-old female was prescribed an injection of filgrastim 300 SEOD. So due to the illegible handwriting, a nurse misread it as an injection cholesterol, which made a problem actually which to the patient, leading that the patient receiving the wrong high alert medication, which is creating a major problem to the patient, and the patient has to go for a severe losses. How to see to reduce the intended errors? When you are prescribing, it should be legible, preferably in capitals. Medicine should ideally be presented generic name, and when brand names are used, it should include both brand names and the generic name on the medication orders and label. Use Stallman lettering for laser drug and maintain and circulate updated laser drug list annually to all staff, which is very important. Carefully read labels every time before assessing and administering the medication. Avoid relying on visual cues or memory, which doesn't give any chances. Ensuring double checking with original documents. In case of doubt, cross check with the physician, which is very important. Separate storage space must be avoided with high alert medications. In terms of medication administration and high alert drug safety, you need to emphasize more on the safe use of concentrated electrolyte solution, which can be seen by standardized dosing, units of measure and terminologies. Prevent the mix up where you can see a lot of issues are more with the concentrated electrolytes. Also, which requires collaboration, verification process and strict protocols, where you can find the labeling practices can be seen as label all medications, syringes, cups and solution when removed from original containers. Unlabeled solutions are unidentifiable and pose serious risk. Discard any unlabeled medications or solution immediately. Keep original containers available for reference throughout the procedure. So you can also see documentation errors which can also be seen as a foundation for safe medication use, which comes from medication history, disease and allergy history or progress notes, drug administration details. Proper documentation can be preventing most avoidable and fatal errors. A case study is being seen over here where a 42 years old female admitted with the issue of UTI. She informed the doctor about her allergy to piperacillin and tazobactam, but it was not documented. She was prescribed ceftriaxone. Initially, when the symptoms persisted, another doctor also prescribed some another combination of this. Since the allergy was undocumented, the doctor was unaware and a severe allergic risk happened to her. The methods to reduce documentation errors can be seen over here where it can foster the strong culture of documentation among nurses and doctors who are the principal reasons for contributing it, and even conduct a regular training for them, emphasize more on the importance of accurate, complete and real-time documentation, and the documentation must be done immediately after the drug administration or not giving a time delay for that. And what is the misinterpretation of the verbal orders? It can be causing a risk. Verbal order gives during round phone calls, handovers or emergency are a very high alert phone where you can find a lot of risk which are developing. Miscommunication is very common, especially when it is sound like drugs or drugs which has a similar numericals. Should be minimized and allowed only in emergencies, which has even a case study which is discussed over here of a 55-year-old diabetic male which was prescribed 13 units of insulin before the dinner. During the shift handover, the outgoing staff verbally instructed, which was not to be avoided, and the patient found that the receiving staff misheard that it is 30 versus to 13, and they administered 30 units, which develop a severe hypoglycemia to this patient. This chart also gives you a detailing of the procedures and methods to reduce the verbal order, and where you say that what to be acceptable, what is the verifiable and what is the ideal practice that you need to emphasize, and you need to see, which gives you a clear depiction of what are the procedures for verbal order and errors to be reduced in this matter. So in summary, I may say that the medication errors that we discussed are at multiple stages, and there are many factors which are contributing to it. It can be from the very start by prescribing, transcribing, dispensing, indenting and administration and documentation. You need to even work on the transcription and indent errors also. Documentation and storage failures also can be added to reduce or even can create, actually if not, that significantly you have to work on the patient risk. So error prevention requires a clear communication. legible and complete prescription, proper labeling, avoidance of verbal orders, accurate real-time documentation, and strict adherence to the medication safety protocol. So with this, we come an end to this chapter, and there are few references which can be taken for being seen as how you need to work on this issue. So with this, thank you very much.